Hello and welcome to episode 87 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is what chiropractors don't want you to know. Ooh, controversial. Gotta love it. Now, before I get into all the juicy bits, if you have not joined our private Facebook group yet, you need to. It is called RehabFix Low Back Program. Individuals who are highly motivated join this Facebook group because they are wanting to get more involved in a community of people who are motivated to find results. Individuals are asking questions in there, finding out more about their situation, finding more about sciatica and disc herniation relief, which is things that, I share and I post about every day in that page. You get access to me, you get access to my team, you get to ask questions. I'll answer your questions. And I post exclusive content in there that I don't post anywhere else. So if you're serious, go join that page. There's tons of value in there. There is thousands of dollars worth of information posted in there every week that you need to capitalize on. If you're ready to be pain-free, ready to be serious, and if you value what I'm saying right now, if you've been listening to my podcast and you value it, then join the page. Show that you're serious and be willing to invest in a solution. Now, today's topic, what chiropractors don't want you to know. Let's see if this gets shared. Here's what I wanted to discuss today. Now, first off, what I'm going to discuss applies to other professions too, just not as commonly, okay? Now, spoiler, I'm a chiropractor. I'm a chiropractor by trade. Not many people know that. Most people think I'm a physical therapist. Other people think I'm like a sports orthopedist. I'm a chiropractor by trade. I just understand that movement is the key for sciatica and disc issues and that we don't need to touch you. However, a lot of other chiropractors would say the exact opposite. And that is what I'm discussing today, what they don't want you to know. Some of this is going to be common myths. And some of this is going to be different tactics that certain doctors use to try to get long-term patients. And that's just not something that I'm about. We've never had a return customer to our program. I never plan on it. I want people to learn how to fix themselves, and I want them to never need us again. I believe that is valuable. So here's what we're going to discuss. Majority, not all, majority, just like I discuss majorities when I'm speaking about disc herniation and sciatica clients of ours, I'm speaking about the majority, not all, of chiropractors too. Majority of chiropractors, their business is based around adjustments, right? Now, there's nothing inherently wrong with adjustments, but here are the things that your chiropractor does not want you to know about adjustments and about the way most chiropractors practice. Most chiropractors, you schedule your initial visit with them, you have some back pain or some neck pain. Okay, most of them want to immediately take x-rays. No matter what you have going on, they want to take x-rays. This is not evidence-based. This is not following clinical guidelines, unless, of course, there's indication of that. If there's a suspicion of infection, a tumor, or fracture, things like that, then sure, take imaging. But a lot of chiropractors, no matter what you have, I just have some neck pain, I have some low back pain I've been dealing with for a long time, I have some thoracic pain. All right, well, we need to check your spine. We need to take some x-rays so we really know what we're dealing with here, okay? Better to check than guess, right? That's what you're going to be told, and that's not true. That is not true, okay? That is, I'm not going to say a lie because I believe most of these providers believe that, but it's not correct. The current evidence does not support it. The current guidelines do not support that. This is not supported by the current literature for addressing most neuromusculoskeletal disorders and lower back issues. So you don't need to check your spine. You don't need to see if things are in alignment or even or uneven. You don't need x-rays in order to get adjusted or to be treated, unless, of course, they lie within those indications that I discussed earlier. Okay, this is not true. Next point, adjustments. What do adjustments do? Okay, I actually made a post on my Instagram about this. A lot of people were quite intrigued. What do adjustments do? What adjustments very simply do are they push your joints into the paraphysiological space, which is basically the space that is beyond your passive range of motion or what you're able to take it on your own. It takes it past that to a point where some gas is released in that joint space and you improve your range of motion. That's what it is. Okay. You put some more motion in there. You're taking it to a degree that it normally does not go. Like you can't really take it on your own. You get a nice little crack. That crack is simply gas being released in that joint space. And for that time being, you will have further range of motion. There are all kinds of neurophysiological effects that are quite amazing, honestly. There have been cases where people with like appendicitis have had reduced pain because of adjustments. Not recommending that. I'm just saying there's crazy cases where adjustments can really reduce a lot of pain in a lot of different regions and cause a whole lot of really cool stuff, to be honest. But that is besides the point. That's besides the emphasis that I'm trying to make here, is that it's just simply a tool to mobilize joints and temporarily reduce some pain and stiffness within those joints and around the muscles in that region. Okay, that's all that it is. What are adjustments not? Adjustments are not necessary tools. They're not necessary. They can be helpful, but they're not necessary tools to realign your spine or realign your hips or, fix the position of your vertebra or anything like that. A lot of chiropractors will talk about adjustments this way. Hey, we need an x-ray to see what's out of alignment. Oh, we see this is out of alignment. Now we need adjustments to realign that thing that is out of alignment. Not true. None of those things are true. Okay? Can they mobilize things and help things groove a little bit better and move a little bit better within their particular action? Sure. But the narrative is very important. We don't want to be convincing people that they're out of alignment or that they're structurally messed up and that they need a specific intervention. They need this because it's a magical intervention that is the only thing that can fix that alignment issue. That is not helpful. That can cause chronic pain in individuals. That can lead to a lot of time wasted, a lot of money wasted, and a lot of fear and worry developed. That is not helpful. Okay? These things should be taken very seriously. The words we use should be taken very seriously. Additionally, so we have the adjustment topic discussed, right? So now, even if you are getting adjustments and you're getting a good narrative, great. But what a lot of chiropractors also aren't doing is they're not providing you additional exercises that you can take home with you to reinforce the changes that you're attempting to make within your body, within your life. Okay, so even if they're not following that old school x-ray narrative, even if they're not providing that adjustment narrative, even if they're good, they're checking the boxes in those, they're good. You should still be encouraged or provided by them some kind of rehabilitative plan or exercises to take home that are specific, not just generic, that are specific for you so that you can reinforce those changes. Okay, getting adjustments feel great. It's great. They feel great, right? Everybody likes getting adjustments. You will get pain relief, but it will be temporary. And you learning what you need to do to resolve the root of the issue, whatever you were lacking, whether it's just simply, moving more throughout your day, maybe it's a strength issue, maybe it's a mobility issue that you need to improve on your own to maintain, right? You can't go to the chiropractor every single day, even though some people are told to do that. I've had clients who were told to go to the chiropractor every single day for disc issues. Okay, that is not realistic and that is not sustainable. You need to have an exercise plan, a rehabilitative plan designed for you to reinforce the changes that are, attempting to be restored by your visits and by your adjustments. Okay, adjustments should not be the sole intervention. They should not be the sole intervention if you have an acute or chronic injury that you are looking for a solid solution for. Okay? So the three main things that chiropractors don't want you to know, they don't want you to know that x-rays are not needed majority of the time to receive care. They don't want you to know that adjustments do not put anything into alignment and are not necessarily needed to recover. They don't want you to know that adjustments are not putting anything back in place because nothing is really out of place to begin with. We can't chase an impossible image of perfection and symmetry that doesn't exist in anybody. So you're not out of alignment and adjustments will not be moving bones or putting you in alignment. And 3, they don't want you to know that you need more than just adjustments to achieve long-term relief. You will not achieve, most likely, you will not achieve long-term results with only adjustments or any passive therapy that is isolated on its own. So what that means is adjustments alone probably won't provide you long-term relief. E-stim alone, soft tissue alone, massage alone, decompression alone, surgery alone, injections alone, pills alone. Anything that is passive, meaning it doesn't require you to put in any work. Anything passive will probably not provide long-term relief. That's the way it is. That's the way your body works. You need to learn how to become in control of your body. You need to be put in the driver's seat. You need to be responsible for your health. You need to be responsible for doing your exercises and improving your function, improving your health on your own. You cannot lay back, relax, and let someone crack it for you. Okay, I'll just crack you and you'll be fine. You don't have to do any work. It does not work that way. True results do not work that way. Okay. Just like there is no diet pill, right? People can't just lay back and lose 50 pounds without any work in a sustainable fashion. Everybody knows that. It does not work. Okay. The same thing goes for recovering from injuries, especially lower back issues, disc issues, sciatica issues. It does not work that way. You need to be put in charge. So what I've described today does not only apply to chiropractors. It's just most commonly applied to chiropractors because whenever people think of adjustments, they think of chiropractors. But physical therapists, they have their own version of this. Medical doctors, they have their own version of this. Massage therapists, they have their own version of this. Anyone who is involved in healthcare has their own version of this. So before people start attacking me and saying, oh my gosh, I'm anti-chiropractors. No, I'm a chiropractor, okay? I'm just well aware of the pitfalls of the majority of all professions in healthcare. Remember, pretty much 99% of every profession in the world, not just healthcare, all professions, about 99% of them suck. That's just the way that it is. There's going to be 1% of any given profession that is really good at what they do, who can really make a difference in the world and the lives of others. Majority are average, and the average just isn't that great. Okay, so I'm not attacking chiropractors, but because I deal with individuals around the world who are looking for disc herniation relief, sciatica relief, low back relief, very, very commonly, chiropractors are sought out for these types of issues. So it is the most related intervention or source or professional that is consulted for lower back issues. So I wanted to use them as an example because it's most relevant. Most relevant. But the same concept, pursuing passive therapies, pursuing unneeded imaging, unneeded tests, still applies to physical therapists, medical doctors, orthopedists, neurologists. Still applies to them as well. You can still take this information and apply it to each of those professions to protect yourself, to protect your body, to protect your mind, to protect your bank account too. All right, this is very important to understand. I am not pro any profession. I am pro anyone who is evidence-based, who is looking out for the best intentions of the client, of the patient, of the health of the individual, and truly wants to make a lasting impact on their life by teaching them how to never need them again, right? That's the best doctor you can find. The doctor who is teaching you to not need them anymore. That is who you want to see. That's what you're looking for. And that is what we do here at RehabFix Low Back Program. We teach you how to fix yourself. We guide you. We have clients all over the world. We have clients in Australia, New Zealand, India, Egypt, all over. We're teaching individuals without touching them, right? You don't need to touch someone to know what the problem is or to know how to fix them. That's a total myth, probably developed by manual therapists. We're teaching them how to fix themselves so they don't need us anymore. That's true recovery. And that's empowering. If you learned how to take yourself from 0 to 100% over the course of a 6-month program, and you learned how to do that, you know how to sustain it. You see exactly how you did it. You know that you can do it. You know that you can be in charge. You just don't have to go lay on a table and let someone else do something to you, crossing your fingers it'll last this time. Get off the merry-go-round. Let's get to serious results. All right? So if you are serious about your results, and you would like to get off this merry-go-round, and you would like to learn how you can resolve your low back issues on your own and avoid surgery, avoid injections, avoid drugs, all this nonsense, then submit an application to work for us. Go to our website, use a link. I'll also leave this link in the show notes. Send us a message on Instagram or through the Facebook group if you're on there, which you should be. RehabFix Low Back Program. That is our private group that you need to join. Get in touch with us. Show that you're serious. Take this next step in your life so that you can live a life pain-free. Okay? 6 months from now, you could be in a completely different place. You could be pain-free. You could be doing whatever you want to do. Or 6 months from now, you could be in the exact same place. And that would be a tragedy. So don't let yourself do that. If you're watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review to help grow this podcast and expose it to more people who are looking for real results from people who care, who want to teach them how to not need them anymore, because they deserve to find relief just like you do if you are listening. So let's share this podcast. Let's leave some reviews for it. Let's leave some ratings so that it has the chance to grow and reach more people. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.